Hey guys, welcome back to Medical Coding with Blue. It is the original Q&A Tuesday. So let's get started with the questions. Lots of questions to answer this time. Thank you to everybody who submitted questions. I really appreciate it. So let's get started. Books needed for exams, like the year. Okay, so one of the questions that I got was about like when you're going to go sit for your exam, like do you have to have that year version of the book? Okay. So depending on which association certification test you are taking, okay? Because with the American Health Information Management Association, they do let the test takers use the, like, if it's 2019, right? They let them use 2019 up to a certain month in the following year. I think it's April that they have to use it till. The best way to know what year books that you need is to go to the website and make sure that you have the correct year version of the book before you go and take your test. Because if you do not, you can't take your test. So you have to make sure that you have the correct set of books, okay? Yes, you do have to have the correct year because sometimes there's updates, and if you're taking an exam, that exam has already had the updates, so you don't want to be using the incorrect year and trying to take a current test. Okay, so never fear, just be sure to look up like what year and what books you need for your exam. Okay, so hopefully that answers that one. And then following up on that one, there was a question about how do I tab my books when you're going in for your tests and things like that. When I went in for my tests, they told us do not have our books tabbed. You could not have any tabs on your books. You could not have excessive writing in your books. Even though they do let you take your books in there with you when you're testing, you can have notes, but don't make them excessive, because they say if excessive, then you can't use that book. Because I don't know why, but that was just what they told us. So it is best to go in with a clean book. As far as like no tabs, you can have notes like in the margin or whatever. Sometimes I will star things, depending on if I know I need to access that's a usual code for me. I will put like a star or like a check mark by the code. I don't tend to put a lot of notes in my book. I don't really do that too much. Even though I use my book actively, like at home, I still I don't like excessively write in it. So if you're going to go take your exam, remember these books need to be clean, because you don't want any appearance of trying to cheat. Okay. Because a lot of times when you go into these testing centers, they want to make sure that it is you that is actually the one taking the certification exam, and they're going to look at your books and make sure that they are the correct book, and they're going to make sure that you don't have any loose papers. You can't have anything loose in your books. So what I recommend doing is looking at the colors and sort of associating the colors with the section. So this way, if you're having to flip through the book really quickly, like the red section or the blue section or the green, so that way it'll help you to sort of navigate that way. And this way, and everything is in order anyway. And as long as you're getting familiar with the book and you're practicing, you will be able to navigate the book even without the tabs, because sometimes the tabs get annoying. I'm not gonna lie. I mean, I do have them tabbed occasionally, but I usually end up taking them off because they get in my way more than anything else. And I've had some pretty scary instances, and I call them scary because it's funny. Like, I will literally open the book and it'll be exactly where I need it to be. So it just works out that way. And but I would just sort of look at the colors and associate the colors with the section, and then that way to be able to flip, so you don't have to have tabs. Okay, so that's just my advice on that one. A lot of times you don't want to do things that are too excessive. in as far as like tabbing your book. It helps some people, and if it helps you, that's great. Do whatever feels right for you in terms of what do you feel most comfortable with. But I'm telling you guys, if you're going into these testing centers, make sure that your book is clean and no tabs are on that book. Right? So, next question. Are claims submitted before or after the codes are audited? It depends on where you are. If they're being submitted for billing, they're going to be submitted with what they have. Hopefully a coder has already looked at it. Some facilities, they have the provider that selects the code, and that's what they submit. Sometimes it's right on the money, and sometimes maybe somebody has to look at it again. So it all depends, but hopefully all of them have been touched before they do get submitted. But like I said, it just depends on where you are. So that's that one. What is a key to understanding the difference between modifiers 51, which is multiple procedures, and 59, which is distinct procedural service? I knew that one, but I wanted to make sure I said it right. So 51, okay, multiple procedures. The best way that I can think of to describe these, or to help kind of illustrate like which one to use, with 51, it's multiple procedures. What I think of off the top of my head is like if they have a steroid injection like in the shoulder, right? They have a subacromial injection into the shoulder, right? That's 20610. And then they have like a biceps tendon injection as well. So that's 20550. So in that instance, because there's multiple procedures going on, okay, that would be the modifier 51 would be appended to the whichever one is less, which I think is a 20550. So if it would be like, to say for instance, it's the left shoulder that's being injected on both sides, right? I mean, both injections are on the left shoulder, or on the left side, right? So 20610 with the LT modifier, and then 20550 with a 51, and then with an LT modifier. Because remember, the modifier that's going to impact the, like what's going to go on with that particular code, that's the one you want to put first. Obviously, a 51 modifier versus an LT modifier or directional modifier, that 51 is going to weigh more, you know, in my mind. That's how I think of it. Which one weighs more? Which one is going to affect the code more? Okay, if I took that LT off, it's I mean, you still need to know which side, but that 51 is going to impact that procedure code more than the LT would. So that's how I decide which modifier to put first. But don't worry, I know I said it before, but I am still working on it, the modifiers, and just sort of go into more detail on that one. Maybe that'll be part of Quiz Friday, is more modifiers. But yeah, that's how I think about it. And then 59, it is that's when you have a separate procedure, a separate area, separate lesion, separate injury from what you're treating. Some facilities do not use all the modifiers. Okay, so that's something you have to remember too. So that's one of those things. Some places are like, you know, they want, I mean, obviously you want to pick a more specific modifier if you can before you use modifier 59, okay? Modifier 59 means there's nothing else that can be appended to that particular procedure. So that would be the only way to describe that. I know that's sort of vague. It's sort of hard to describe because 59 it's like when a separate thing is going on, but no other modifiers like 51 can be appended. You know what I'm saying? Like If you aren't using modifier 51, then yes, you can use modifier 59. But with 51, you're going to think of it in terms of when you have multiple procedures going on. When you're using modifier 59, it's separate lesions, separate areas of the body, different things that are being treated. 51 and 59, just so you guys know, they are never, ever, 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 ever put on the evaluation and management levels. Never. Okay? Those two, 51 and 59, are only for procedures. Okay? So just be sure to keep that in mind. Like I said, I will be doing a modifiers generated one, just sort of we can go over in more detail so I can get more examples together. Because I do know that there is a really good website that talks about modifiers, but I couldn't find it in my bag of tricks. So, yeah, but that is basically on that one. So, sort of look at different websites too that talk about the modifiers because that really does help. Being sharp on those modifiers is a really good idea because those modifiers really can tell more of the story of what's going on, so keep that in mind. Okay. The next one, the activity codes on sequela. Okay, so the only time that you're going to be reporting those Y codes for the activity is when it's the initial visit, or you have like in the case of that one where they had the overuse of a muscle, and then it asks for the activity that caused the overuse. That's when you would use those Y codes. Y codes do not go on sequela. The only thing that's going to go with sequela is the external cause code. What happened? How did it happen? But the Y codes are basically status codes, and they're only going to go on initial visits and with those overuse codes, those M overuse codes. We talked about that a few ones back, and I'll do a refresher on that one because I think it's worth more discussion on that one. Okay, because there is a section in the ICD-10 book for that overuse code, those overuse codes, that talks about that it needs to have that Y code, but that's only to tell more of the story. Okay. Also, if you ever have an instance where you're doing a initial visit, right, and you don't know the activity, you're not going to ever use that unspecified activity code, okay? That's just a tip from me to you. All right? So, next question. Modifiers on PRP. So, PRP is considered a Category 3 code, okay? Now, these little special category codes, the Category 2, Category 3 codes, they have their own modifiers. And if you look in that section for Category 2, it talks about the different modifiers that are for that section only. This is why with PRP you would never use a modifier. And I've had to talk about this to my providers as well, because they got into the habit of going ahead and putting the directionals on there, and I had to remind them that with PRP, because it is a Category 3 code, right, the Emerging Technologies section, right, and there's not an official code yet, that's why it's in Category 3. They're essentially codes that are waiting to be asked to the prom. That's how I always think about them. But those Category 3 codes, they're like, I don't want to say they're like unspecified codes, because with unspecified codes you would never put a modifier on an unspecified code. You just never do. And I don't want to say that because they're not unspecified, because they do specify. But like I said, if you read the rules in Category 2, Category 3, it'll tell you about those special modifiers for Category 2. So that's how you can sort of know about those. But yeah, I know it does get confusing, like how do you know when? But in the expert version, they talk more about the modifier. So if you have a CPT expert version, right, it's going to let you know, modifier, you can't use this modifier, or you can use this modifier. So just sort of look at that. There's a lot more notes in the expert version. So that's all I got on that one. But yes, we will be talking more about modifiers. So if it doesn't make sense yet, it's all right. Just go with it. We'll talk about it more in another video when I can break it down a little bit more. Okay, so does getting multiple credentials make you more marketable? Okay, this is a very hot topic, very popular question. When it comes to getting multiple credentials, right? My suggestion is this: when you are very first starting out and you haven't even gotten your first job with medical coding yet, start with one. One credential is all you need. Okay, one just to get started and get your foot in the door. Okay. Now, if you decide after you've gotten your foot in the door somewhere and you decide you want to go ahead and expand your horizons and get more credentials and get credentialed through both associations, then by all means, go right ahead. But the only thing to remember about this is when you have multiple credentials, you're going to have more continuing education units. Okay? That's something to remember, because certain employers offer continuing education units as a benefit of employment, like me. I don't have to pay for mine because I get them through my work. I also get them whenever I attend a conference. So there's many ways to get continuing education units, but what makes you more desirable for employers is when you know what you're doing, when you can pass their entrance exam, and they give you a test every time you go and apply for a new job. If you can ace that exam and say, yeah, I pretty much know what I'm doing, that makes you look good, that makes you more marketable. When you expand yourself and allow yourself to learn many different disciplines, not just concentrate on one discipline. Yes, it is good to be very good at one specialty, but it also makes you more marketable when you have experience to do a lot more different types of clinics, a lot of different types of different settings. Okay. So when I got my job here, I had experience in coding for inpatient professional service rounds, and having that experience was what helped me to be able to get in, because when I got to that place where I was learning to do that, nobody wanted to do it because everybody said it was too hard. There's too many rules. And for me, I think, certain places call it profi or something. But when I got to the place where I was learning how to do that, I was so brand new that I had no idea to be afraid. All I just said was, sure, I'll do anything. And when my supervisor at the time, she said, well, would you like to do this clinic because nobody wants to do it, and they say it's too many rules, and I was like, yeah, just tell me where I gotta read and show me what I gotta do and I'll do it. And she's like, really, you don't mind? I'm like, no. So you have to sort of have a different frame of mind when you code in that particular clinic, and for me it wasn't hard because of the way it was explained to me. Having a good teacher also plays a big role in how people take things. So if you have a really good teacher, be sure to thank them. I did thank she's my friend. I call her my friend now because we've spent so many years together now, and she's the one I ultimately trust when it comes to coding advice. If I need to know something, she's wonderfully smart, and she's taught me so much that I always go to her. If I ultimately need advice about coding, I will go to her, because I know that even though she may not think she knows so much, or she knows how to find the answers. So that's why I always go to her, because, she knows what she's doing. And so I've learned so much from her, and because she taught me, that was what I brought here, and that was my knowledge base when I got here, because that learning how to code in that particular clinic, I coded for everything. I coded for mom and baby. I coded for psych. I coded for internal medicine, and in the so on and so forth. So I knew a broad range of clinics. That is what makes you more marketable. And somebody who has an alphabet behind their name, it's very impressive, yes. But if they don't have a lot of experience in coding different clinics, and they're more specialty, and they only code a certain thing, it sort of narrows down where you can and can't, where do you have your experience, So being well-rounded makes you more marketable more than anything else, So like I said, start with one credential, start with one association, okay, and sort of build a relationship with the association that way. I'm with the American Health Information Management Association. That is who I am credentialed through. I really do love this association, because I've gotten so much from them. I mean, I've learned a lot from them. Just the camaraderie that I get whenever I get around people from my association, it is amazing, and I love talking with them. I love meeting them, because they're all so different, and they're all so smart, and I love that. I love being around smart people, because when you're around these smart people and you start having these conversations, then your mind just gets like blown, because you're just like, wow, I didn't think about this, or I didn't think about that, or now I can see it this way. So it all depends on how you want to look at things too, when you're deciding which credential to get, or which association to go with. Just look at both websites. I will include the website address for both in the description box below, so that way you guys can check out these websites and see, and call and talk to customer service, and see if if you have any questions, you can just ask. So this way they can be able to help you better. Especially with the American Academy of Professional Coders. I'm not associated with them, like I don't have credentialed through them, so I don't really know too much about their association, but I do know that they do have a customer service line, and so you'd be able to answer ask them questions. So just be sure to consider that, because like I said, with trying to be more marketable right out of the gate, your first goal when you get credentialed is to pass your exam, right? And the second goal is to get the job. You got to concentrate on those two ones first before you start giving yourself too many tasks, okay? Just stay with one goal, and which is to get your credential and then get the job. And that's going to be a big task in and of itself. But if you do decide ultimately that you want to get another credential, by all means go for it, okay? But I'm telling you, it's more continuing education units. It is another association, or even if it's with the same association, it's still going to be more continuing education units. So something to keep in mind, okay? One thing at a time. All right, and the last question is, it was tabbing in the books. Okay, so that was it on the questions. But yeah, that is Q&A Tuesday for today. I hope I answered all of your questions. I know the modifiers one gets a little tricky. And like I said, I will do more where I'm going to break it down, because there's so many different modifiers. And there's certain modifiers that I don't use because I'm not in that setting. So I have to do research on my own before I start talking about it, But yes, So if you guys have any other questions, please be sure to keep them coming, because I'm always preparing for next week's Q&A Tuesday, original Q&A Tuesday. So I will be leaving my email address down in the description box below. And so if you have any questions at any time, be sure to email me, and I will include it and I will let you know. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right. Well, I will see y'all on the next video. Bye.